Myself is Dr. Kamal Narayan Arya. I am working as a faculty at the Pandit Deendayal Upadhyay National Institute for the Person with Physical Disabilities at New Delhi. So the basic difference between occupational therapy and physiotherapy is basically the media of treatment. The media of our treatment is activities. So in case of a stroke, brain understands activity easily. Our brain has been taught from birth how to use objects, how to drink water, how to carry object, how to lift bottle, how to play ball. And when that same brain gets insulted or injured due to stroke, if you teach only movement, the brain feels difficult to learn it. But if it is the brain through objects, the same movement via object like carrying a ball, lifting a ball, throwing a ball, or squeezing a ball for hand movements, the brain learns it very easily. So that forms the basic difference between what a physiotherapist and what an occupational therapist does. And there is also a form of principles of neuroplasticity or neuroscientific theories, which is based on using the objects. See, it's very difficult to say one specific. There's so many techniques that are coming up, but the most important thing for the students are to go for the proper and a formal assessment of the problems, whether it is a motor paralysis or about cognition or perception, which are very commonly seen in this type of stroke population. They have difficulty understanding, they have difficulty in following the command, they have difficulty in communication. So they have difficulty in moving the hand, arm, leg. So they have formal assessment, which we are teaching them in this workshop. So how to assess, so that should form the basic skill. So if they have the idea of the basic impairment, so they can plan the management over it. See, apart from that assessment procedures, they should, apart from the knowing the recent therapies coming up and what is the scientific basis of those therapies, what is the evidence-based practice. That is most important, that what are the evidences for those therapies. There may be 20 techniques in occupational therapy, but which techniques have more evidence as per the scientific basis, as per the research basis. So they should know the evidence-based practice. Apart from that, they should also know what are the things which are contraindicated in these therapies. Like in today's workshop, we are talking about the passive range of motions is detrimental for the shoulder. So that will dislocate the shoulder. So that should be stopped. So the student should be aware of along with the recent updates, with that they should also be aware of the contraindications. I definitely is a very vast role because the stroke incidence is increasing day by day, and the prevalence is somewhere gone around 1,000 per lakh of patients, per population, and plus the stroke is getting younger day by day. 20 years back, the stroke is used to be disease of 60 plus, but today it is used to be disease, or very commonly we have 20 plus patients. So they have to stay a longer life. If somebody has a stroke at the age of 20, he is going to survive for 80 years or say 70 years. So the person requires therapy or the care for the 50 years. So definitely is a larger scope for this OT students. So my basic advice is that should be aware of the evidence-based practice. They should be aware of the contraindications, and they should use their knowledge and the skill based on the scientific theories. The stroke rehabilitation is based on very strong science nowadays, starting from the animal studies to the human studies. So lots of theories are coming up which are utilizing stroke rehabilitation, which are based on animal studies. So they should know all those things. As I said, that now the stroke is happening in the young population, and definitely job rehabilitation, the vocational rehabilitation is very, very important. So occupational therapists assess these patients, their abilities, their impairment both together. Every patient has abilities and the disabilities. So based on the abilities, we suggest them certain jobs, and then we advise how to utilize the available body parts in that occupations. Like that we have one patient who has started accountant and he just suffered a stroke. So how he has to go back to the chartered accountant job, because his one hand is not working, he has to use the laptop. So there are certain devices which can be provided to them to use the laptop in his job occupation. So we assess the abilities and the job accordingly. We provide some devices, some therapeutic techniques to go back to the previous job.